I am Professor Anil Arora. I am Chairman, Institute of Gastroenterology, Hepatology and Pancreaticobiliary Sciences at Sir Gangaram Hospital, Rajendra Nagar, New Delhi. Hepatitis B, unlike hepatitis C, is not a curable disease. Once you get hepatitis B in adults, there is a good chance that you spontaneously clear the virus in an acute phase. But unfortunately, in 5% of the adults and 90% of the children, if the virus gets stuck up in the body for longer than 6 months, that is called a chronic carrier state. Unlike other viruses, hepatitis B virus continues to get integrated into the human genome, and hence it is very difficult to get rid of it. There are very good drugs which are available now for suppressing the virus, but since the virus get into the body's own cell and the nucleus and the DNA, and it is not easy to get rid of it. So there is a perpetuation of infection. That is one reason, from maternal mother to the child, and secondly because of the indiscriminate use of disposable needle and syringes if there is an infected person, especially in IV drug abusers, and if there is no good screening of the blood. These are the major reasons why, in spite of vaccination which is available for a long period of time, the virus continues to cause major havoc even today. I think it is a combination of the both. Whenever the patient has hepatitis B, unfortunately patient does not have much symptoms, and even if the symptoms are there, they are totally non-specific in the form of fatigue, weakness and generalized irritability. But that does not point out to the hepatitis B as the cause of the symptoms. And unfortunately, by this time symptoms related to hepatitis B, they pop up in the body in the form of jaundice, swelling in the feet or tumor in the liver, then the disease is too advanced. So it is very important that there should be a general screening for everybody for hepatitis B. If the person is not infected with hepatitis B, there is a very good, effective, cheap, safe and efficacious vaccine which is available, which gives you almost 100% protection. And if you are infected, and if we can treat you at a stage when the disease is not symptomatic and when it has not produced substantial damage to the liver, including cirrhosis and hepatocellular carcinoma, the results are much better than treating it in the advanced stage. Most important part on the patient or the general public should be, there should be awareness of hepatitis B. Everybody in the family, every household, every single Indian, everybody on the earth should get screened for hepatitis B for two reasons. First is that if you are already infected, and the rate of prevalence of infection varies from different country to country. In India, the general prevalence is anywhere from 1 to 4% in the general population. If you are already infected with hepatitis B, if we treat you at a stage where you are still having an early disease without substantial damage to the liver, so we have good drugs which can take care of your liver as well as the virus. From doctor's point of view, I think we should have more CMEs, more continuing medical education program. We should have health awareness program. We should conduct more camps to increase the awareness in the public by not only providing the free kits for early testing, but there are now good drugs available because of the availability of the generic drugs in Indian scenario by good Indian pharmaceutical industry. We should be able to provide them good, cheap and effective medicine for hepatitis B, provided we catch them early, provided we catch them at a stage prior to development of advanced liver disease and liver cancer. I think the single most important, most relevant message for all of you would be that all of you should get screened for hepatitis B virus in the blood. Very simple test, very cheap and very effective. And if you are not protected against hepatitis B, there is a simple vaccine which is available, which does not have any significant cost, which does not have any substantial side effects, and gives you almost 95 to 100% immunity. Because there are a number of procedures which inadvertently can lead to development of hepatitis B, like shaving of the beard, shearing of the common blades, like tattooing, like acupuncture. All these indiscriminate use of needles can inadvertently give you hepatitis B. So if you are already protected, then none of these procedures are going to be harmful for you. So please, my single message will be that go and get everybody in your family, your mohalla, your district, your state and country tested for hepatitis B. If you do not have a vaccination, please get a simple and effective vaccination done immediately.